Tonight, there's new hope for people who faint frequently. It's a heart surgery.
And just a few doctors in the country can actually perform it. And one of them lives right here in our area. Jessie Schultz introduces us to a Canton mom who had the surgery and says it's been life-changing.
Sunflowers, cosmos.
Hannah Grable does not take things like being out in her garden for granted, because this time last year, she wouldn't have been able to walk to her garden.
4 times a day I would faint, and when I say faint, I mean to the floor.
Grable has a vascular syndrome that comes with other comorbidities like POTS, a syndrome where your heart rate is irregular. She would pass out as a kid, but says it didn't happen frequently until last summer when she contracted COVID, which worsened her symptoms.
I couldn't pick up my kids because I was afraid I would pass out and drop them.
Her heart rate could not regulate.
I remember one of these times I looked at Alex, my husband, afterwards and said, I feel like I'm dying.
The mom of 2 young kids was debilitated. She was told by several doctors there was nothing they could do to stop it, that it was anxiety.
You can be told by 10 doctors that you're crazy, that this is in your head. But that 11th doctor will believe you.
The doctor who believed her and offered help was Dr. John Clark, the director of Akron Children's Pediatric Arrhythmia Center.
That is the typical patient who ends up in my office for this, is the patient who's failed every therapy, is on multiple medications, and really wants to get their life back.
He is one of few surgeons in the country that offer cardio-neuroablation for the treatment of frequent fainting. It's a surgery that reprograms patients' irregular heart rates, and one that is not yet FDA approved for frequent fainters, but can be an option case by case.
It had not been a therapeutic option until the last couple of years in the United States.
Grable underwent surgery in December.
I can stand and hold my kids, and I don't get that awful feeling you get before you pass out.
And she hasn't passed out since.
You don't realize how much autonomy you have until you become sick and it's taken away. And he gave me that life back, the opportunity to live and
Reporting in Canton, Jessie Schultz,
be normal.
News 5.
She's getting her life back. That's a wonderful feeling. And Dr. Clark is hopeful as the FDA receives more research regarding this surgery for frequent fainters that it will be approved as the first line of treatment and not the last.